Public Health Program Coordinator Lawrence Alam and CDC Technical Advisor Katie Tripp to talk about this iodine survey that they're conducting in the island's public schools, clinics, and even the mom and pop stores. Thanks for joining us, both of you.
Thank you, Nick.
So tell us, Public Health and CDC is doing this joint effort and going out there, educate the community first. Iodine, what is it?
Iodine is a mineral. It's very much like a vitamin. It's very, very important. It's critical to the health of everybody, but it's particularly critical for pregnant women and young children, as it really helps them to grow strong and smart and healthy. So it's very important.
Okay, so there's a survey that's being conducted. Tell us the importance of the survey, and then we'll go into how it's conducted.
Well, one of the reasons why there's going to be a survey in Guam is that iodine deficiency is one of the leading causes of intellectual disability in the whole world. There's actually 2 billion people affected by the deficiency, and we really don't know what is happening in Guam. We have some data from the U.S. mainland to suggest that there are some problems with iodine status, especially in pregnant women, and there's also some data from Pacific Islands that have suggested that it's also a problem. So we want to make sure that women and children and the population of Guam is growing healthy and strong. So it's very important that we do the survey to make sure that everybody is developing well.
What are some of the symptoms or deficiencies as a result of the lack of iodine?
The main deficiencies that you would see as a result of iodine deficiency are intellectual impairment. So you will see children can have low IQs and they are really capable of having. Some of the serious results of iodine deficiency are goiter, where you would see a mass growing in the neck. In the past, you would also see people with cretinism and very severe intellectual disabilities. But it can also cause miscarriage and stillbirth and a whole range of other problems. So it really is very critical. Iodine also regulates your thyroid hormones.
Tell us how you went about, the idea of doing such a survey on the island. Was it Public Health that approached CDC or vice versa? How did this work?
Actually, it was WHO really spearheaded the project. They were looking at us to conduct a survey, and so WHO communicated with Public Health and CDC. So it's a 3-organization effort between our Public Health, WHO, World Health Organization, and the Centers for Disease Prevention and Control. And now, as we went into the implementation phase, we also got the Guam Department of Education involved, as well as our private clinics and public clinics, we are really happy about it. Yeah.
So, what have we found so far through this survey?
So right now we're just in the implementation phase. What we did was in the beginning of the year we randomly selected 19 schools from the Department of Education. Actually, it was supposed to be 20, but one of the schools was so large that we picked that school 2 times. And then we also had buy-in from the clinics that we have right now. So what we're trying to do is survey 720 children and 290 pregnant women. The children are randomly selected, and the pregnant women will be sampled conveniently. So it's a convenient sampling method. Now, what we're finding is we're having a lot of declines from the school children, from the parents, and I believe it's because a lack of knowledge about iodine, because really it's a trace mineral that's not really talked about. I mean, if you say blood sugar or cholesterol or something like that, people have a general knowledge about those things, but this one is a little bit different. They don't know that iodine is much like vitamins and minerals and all those things. So, like what Katie was saying, there is a problem with iodine deficiency, and we wanted to find out because this is going to be the first time that's going to be done in Guam, and actually I would even say in the Micronesian Islands. And so we want to find out whether there is an iodine deficiency, and if there is, the solutions are pretty simple. Like if we can promote the use of iodized salt among when we cook our foods and stuff like that.
Okay, that's pretty much leading up to my next question. What are some of the vitamins, foods, drinks even that the community can take? If you could just let them know.
Well, iodine is contained in many foods, particularly seafood, seaweed, shellfish. And also vegetables and fruits, but the problem is that not all soil contains iodine in equal amounts, and actually in places where there's a lot of rainfall and environmental conditions vary, then the iodine can actually be very, very poor quality in lots of the things that people eat on a daily basis. So the best way of eating iodine and making sure that you have enough iodine in your diet is to consume iodized salt. And luckily, this is one of the most successful public health interventions in the world. It's extremely low cost. There's really no difference. You don't have to incur any expenses to make a healthier choice for your family. So we're really happy to let people know that iodized salt is really an excellent way of ensuring that you have enough iodine in your diet.